Welcome to Humber Teaching Foundation Trust board meeting today, and welcome to all my board members. I'm Caroline Flint, the chair. I haven't received any apologies, and I think we have a full house today. Yes. Declarations of interest. If there's anything on the agenda that there's a conflict, please remove yourself from that item. And anything where you need to update your declarations, please let the Trust Secretary, Jenny Jones, know. No conflicts of interest from anybody? Nope. Okay, thank you very much. Moving then on to the minutes of the meeting held on the 29th of March. Are there any corrections to those minutes? Or any matters arising from them or from the action log? No. Okay, thank you very much. Can we agree that the minutes are a true record of the meeting held on the 29th of March? All nods I'm seeing there. Okay, that's great. Thank you very much. Moving on then, we have my chair's report. So I would just like to say a few things at the start. First of all, to say it's really great to see you, Mike, here. I know you've been very poorly recently, and I know I came to see you, and I know other colleagues have been in touch as well. But yeah, it's really great to see you here, and look after yourself, and we appreciate your time being with us today. So thank you very much, Mike. I'd also like to just thanks, Mike. I'd also like to just point out a couple of things from my report. First of all, to give our congratulations at the board to Michelle Moran, our chief exec, who was named one of the top 50 chief execs in the NHS in the country by the Health Service Journal magazine. It's an incredible accolade, and not only does it reflect so well on Michelle, but I think it reflects well on the trust too, and congratulations to you, Michelle, for that. And please, can we have our congratulations minuted for this board here today? Well done, Michelle. Thank you very much. I've also just flagged up in the report, he's not going, we're not letting him go anytime soon, but Hanif will be leaving us at the end of his term of office. But we have already had some really helpful discussions about the associate non-executive director role, both with governors and at our last strategic board session. And I know Hanif will be helping me in particular as we think about how we recruit the next associate NEDs, and I think in principle agreed that we should have more than one. So I'm looking forward to working with Hanif on that project, and he's still with us. He's still with us, and we're glad he's still with us for a while yet. Thirdly, just to point out, we had I think our trust board strategic development meetings are going really well. I think we obviously have to work hard at making sure we don't put too much on the agenda. But so far this year, I think these meetings that we're having are proving their worth in terms of having that time to look more strategically in more depth at some issues that the trust face. And as you can see in my report, we covered quite a lot in our last meeting in April on our people strategy, on our programs to support people's development in the organisation, our digital strategy, are looking at risk and how we identify risk, but also the type of forms that we use to add the tools that we use to understand that work. And as I've mentioned already, the associate non-executive director role as well. And we're also undergoing obviously our board development, and that continues our next strategic meeting in June. So those are just a couple of things I just wanted to pick out. Alongside all the sort of committee meetings, just to say I attended quite a few meetings since we last met as a board, and I was really impressed by the quality of the discussion and the chairing, I have to say, by my colleagues, non-executive directors at these different meetings, which provides me with assurance about how much is discussed and delved into prior to the assurance reports coming to the board. So that's a few highlights from my activities since the last board. Any questions or comments? I'm happy to note. Brilliant. Okay. Moving on then to the Chief Exec's report, and we've got some policies to ratify as well this month. Michelle.
Yeah, good morning, everybody. Thank you. I have got some technical problems. I do keep going off, so apologies if I do that. But first of all, thank you for your comments about the chief exec piece. It is a team effort, so thanks to everybody around the table as well as within the organisation. And that comes with responsibility as well, which I'll come on to. There is a couple of policies. Apologies for the title, but there was not bought and no engagement policy. That's a bit of a mouthful. And then the business continuity policy to come back to. As always, I'll just pull out a couple of things. It's a detailed report, so my colleagues around the table which will assist. We've we've had a conversation with the exec team, and we're going to start to highlight visits that we've done, because obviously I put them in my report at the beginning, so all directors will be pulling out theirs. It's great to see Hillary's is in there, so all directors will continue and start to do that. So we get a bit of a flavour of just the breadth of the visits that people are doing, other than the knowledge visits that are the schedule one. I mentioned the company responsibility. I've been asked to be a Health Service Journal judge, which is quite an important role, which is quite exciting, but obviously that does affect some of the categories that, not that we apply for, but that I'll be able to actually judge in. So we'll watch this space, but there's a couple of days that I'll be out to do that, but I will keep you posted. There's quite in the report a lot of people changes. I'm not going to list people moving around, people being appointed. I think hopefully it's self-explanatory, but happy to expand on that if required. Quite an interesting piece of work that I have pulled out is the levelling up work in Hull. I think that's a really exciting opportunity to build on the work that we've been doing with the community in Hull. That builds on a little bit of the Beverley Road project that was a little before COVID, if we remember that, but a lot about the social economic as well as the health and social care aspects. I think that's quite exciting, and I'm having several meetings at the moment to see how we can link into that. So I will keep the board posted, and maybe at some point, maybe not now to know, but we could maybe pick that up in a strategic session as well. Apologies, but not apologies. I've listed the ICB Integrated Care Board objectives. I thought it was quite important that we had a look at those. Here they have been agreed now. We have seen them before in various guises. They do link into our strategic direction and ours, but I just thought that they were quite interesting for us to be aware of. Lots of political changes since the local elections, which are affecting some of the working, because obviously we had personnel that we were working with from the various councils through Health and Scrutiny and the Health and Wellbeing Board. So that will settle down and we'll continue that. But there are some, but we've listed all of them for your information. It's interesting to know that nationally we've stepped down completely the COVID. If you remember, the incident level's been reduced and it's been stepped down completely. But we will be getting notification about, no doubt, COVID vaccinations in winter. We've already got the flu letter for our winter vaccination programme. I know it's not June yet and we haven't had much sunshine, but we'll be working on that alongside our winter plans as well. It was great, and I'm sure Hilary will pick up a bit, great to celebrate International Nurses Day. Being a nurse myself, it was great to do that. I know we're a multidisciplinary team, but it was great to celebrate that. And I know that there was a few little tea parties around the organisation. So thanks staff for organising those on top of their challenging work days. Thanks to HR team and others in relationship to the appraisal window. That seems to be going exceptionally well with the figures and the numbers, and I believe most people around the table now will have an appraisal scheduled, which is great. And one of the things that we're looking at this year is obviously being humble, but also about the quality of the appraisal, because it's important that we don't just do the appraisal, but the quality aspect as well. And the exec team will be looking at that at the end of that session. A couple of important things: primary care telephone system. I don't know if Pete wants to expand on this. As you know, we have had some complaints and some issues with our telephone response system in primary care, and that's it's part of a national issue, but it's also so we are invested in that. So that should ease some of the problems we've been having. And it will be interesting, as I say, moving on from an estates point of view, to see the Trust HQ demolished in summer, because we can start to look at that site in a bit more detail, and that links into some of our strategic work. I will stop there. We have got lots of things in relationship to membership. We're cleansing the membership. There's a piece on there. There's also lots about communications, as always, and health stars. Finally, it was really good that the Provider Collaborative, still in its infancy, is going to be part of the ICB annual report, and it's really good to see that. So thanks to the team for that. I'll pause there, Chair. My colleagues may want to come in. I'm sure Lynn will come in just a little bit around the bank holidays and some of the strike works, because we have got through the bank holidays. It's good, it's bad, but we have got through them with minimal disruption, thanks to Lynn and the team and others. But I'll pause there and pass over to my colleagues and then back to the board. Thanks, Chair.
Thanks, Michelle. Could I just see which other executive directors would like to add something to this report item? So I've got Lynn. If anyone else wants to show, that'd be helpful as well. Lynn.
Yeah, just to build on what Michelle's already said about operational pressures, obviously the report explains the position, but we have been continuing to stand up our silver and reporting to gold arrangements to manage industrial action. So that has stood us in good stead. We are planning for the next industrial action period by the BMA, which is, I think, the 14th of June. We'll take the similar approach that we've been taking so far. So we do expect that to cause as little disruption as possible, but obviously it is an ongoing scenario that we're working with at the minute. Other unions are still balloting as well, which you'll be aware of. So obviously just keeping a very close eye on that through our EPRR arrangements. Caroline, thank you.
Thanks very much, Lynn. I can't see any other executive director hands up. Over to everybody. Any questions or comments? Francis.
Thanks, Chair. Two questions and one comment. The first one was to Lynn on the operational report, which is great and really detailed. I was just wondering, you talk about the fact that whilst system pressures have improved slightly on our side, the acute side has been at Opal 4. And I was just wondering what had driven that and if there was any knock-on effects for us.
Yeah, I think, Francis, thank you. The report does say that actually the position for the acute hospitals at least has been varying a little bit more, that they have reached Opal 3, albeit for quite short periods of time. What's been driving that is some of the impacts of the industrial action, but pressure still through the emergency departments, demand still being high, and particularly impacted by some of those bank holiday periods as well. But as I say, there have been some periods where hospitals have reduced to Opal 3, which hadn't been the case sort of a couple of months ago. So some glimmers of sort of demand becoming a little bit more stable, but overall system pressures have still been high for the last 2 months.
Thanks, Lynn. And then my other two were in Hillary's section. One was which Michelle's raised, was great news. All of the entries for the awards is fantastic to have 11, and great effort, because I know there's a lot of work goes into just filling in the form just to get in there. So well done. And the question was around the Professional Earth Advocates, which is a fantastic initiative. I was just wondering how many, to achieve the ambition that you've got, that we have everybody in the trust will have access to a trained PNA, how many do you actually think we're going to need long term to do that?
Finger in the wind, about 50, I think. So they're still quite early days, and we'll have to wait nationally while they keep releasing more and more of the training. It's level 7 training, so it's master's level training. So again, it's nurses that want to come forward, but whenever they put the training out to us, we've got nurses waiting then to go on that training. So that's really positive that nurses want to do this, and having met them, all of them, a couple of weeks ago, giving them the certificates, real excitement, real buzz amongst them all. So it really is something. The more we can get, the better, I think. But obviously we've got to manage that with the time capacity as well with the role, because they've got 7.5 days, I think it is, that not 7.5 hours that they need to, each month, that they need to play into this. So we've got to build that in as well. But they really are a fantastic role, and it's just watching it develop now from nothing, and that excitement there. But yeah, 50 would be good.
That's great, thanks. Because obviously we're spread out, so it's getting people all around the patch, isn't it?
Yeah. So we have now, as you can see, we've got them, but we need more, don't we? Yeah.
Great, thanks, Hilary.
Thanks, Francis. Hilary. Stuart.
Thanks very much. One for you, Michelle. Thanks for your very detailed report as ever. On the question about the ICB objectives, are there any kind of hard trackable metrics underpinning these statements of objective?
Yes and no. They started to develop some metrics. I think they want to try and keep them obviously very smart and
Yes.
and very simple. So the first lot were really quite detailed and complicated. So they've gone back to the drawing board, but there will be some high level performance metrics on those that will be both measured through place and through the provider collaboratives. So they're developing at the moment. So once they are, we'll bring them back and we can have a look at them, because obviously we'll be accountable for some of them. But we do need to keep them very simple and linked into current performance targets that are national targets as well. So we need to dovetail them both together, those that we have to do as a system, those that we have to do as organisations, and then maybe the additional ones on top. So they're developing at the moment. They'll also link into the quality and effectiveness group, productivity group that's been set up, because a lot of them will try to be linked about efficiency and productivity as well. So watch this space.
Yeah, and is there a mechanism we have to go through to make sure that our own plan for this year and beyond is kind of properly connected? I mean, there are so many echoes, aren't there? The sort of the terminology being used and the ambitions, but is there a sort of a thread to needle piece of work that needs to be done at some stage?
There will be. I mean, obviously, we're reviewing our performance metrics at the moment, so we've been cognizant of those that are developing through the ICB.
Yeah.
Because obviously, I'm part of that, and obviously that's coming to the next June strategic session to work through. But as they develop, then obviously we'll keep reflecting in to make sure that we're accounting for it, and secondly, it's measurable from our point of view.
Thank you.
Thank you, Stuart. I can't see anybody hands up. It is a very detailed and full. Oh, sorry, Steve.
Yeah, thanks, Carl. It was just one on the policy, actually, on that the was not brought and no engagement policy. I just wondered, did we talk to our staff side colleagues on that one? I wasn't at EMT, I know, when it was discussed, so apologies, but did we talk to our staff side colleagues, given it was affecting staff, and how we do kind of effectively a staff policy?
To my knowledge, Steve, it has been through staff side, because I remember the title, but we can actually double check that. But my knowledge is it's been through there, but we can double check it. Unless any colleague wants to add anything.
So it is a patient facing policy about not doing your appointments. I'm not sure why we would want to engage with staff.
Okay. It talks about outlining the roles and responsibility of staff in response to how we work. So I just think it would be one to maybe talk about our staff colleagues with. Yeah,
well, that's in all policies. What I think it's saying is about the roles and responsibilities of staff within the policy framework, which is in all policies. I will have another look at it, but it is focused on staff and how they work with patients to try to make sure that they come to appointments, and also obviously young children not being brought. So it is focused on patients.
Yeah, no, I've read it, Hilary. Yeah, I just think there's some elements in there about deploying of staff that it would be useful maybe just to include staff side. It was just a question about whether we'd got their views on it. That was all. I'm sure we have, actually, Steve, to be honest. I remember I've seen it in 2 or 3 guys, these 2 meetings that I've been to. So, but just for belt and braces, we can double check, but we can still approve it here. And if we haven't, we can make sure it comes in. If there's any changes, we can bring it back.
Okay. Thanks for that. Yeah. Okay. So, I mean, I can see there's probably a link there, because there's been a national story, hasn't there, around a child that, not in the NHS, but certainly who died. And social workers hadn't made attempts to see the child in person or hadn't contacted properly. And I presume some of this is bound up with that. When you don't see a child, a young person, or a vulnerable adult, you don't know necessarily what's going on. And I suppose there's that sort of mutual thing around staff, is that if something does go wrong, then there will be questions asked about how staff behaved in some of those situations. So, yeah, I mean, it's there's probably points on both sides on this. So, look, subject to that sort of verifying, where staff need to be informed formally, are we happy to ratify this policy, and that discussion can take place outside of this meeting to ensure that everything is pulled together for this policy area? Yeah, okay. And also on the business continuity policy, everyone happy to ratify that? Thank you. Okay, thanks very much for that report. Moving on to item number 8, publications and highlights report.
Yeah, thanks, Chair. This is again the usual paper. I won't go through it in detail. It's got quite a lot of updates on. The key ones are picked out on the front sheet. We touched on a couple of these already, but I'll just throw it out if any of my colleagues want to answer any questions or add anything additions. But it's just here to note at this stage. Thanks, Chair.
Thanks very much. Okay, no. That is noted. Let's move on then to the performance report. Pete.
Thanks, Caroline. So this is the report as at the end of April. It's in the current format that we've seen for the last 12 months. You know, you'll see from the front cover that areas of focus remain waiting times, safer staffing and delayed transfers of care. And this month we have got the full waiting times report attached as an appendix. So thanks to Lynn and Claire for pulling that together. We did see a small dip in CPS 7-day follow-up, but there is a level of assurance that the 72-hour follow-up is there, and the front cover does identify what we do when we identify a breach. And I think it's worth noting that we continue to see strong performance overall on our aggregated statutory and mandatory training performance. One final point I was going to mention, but Michelle's already teed it up earlier, is we are planning a review of the performance report at the strategic board session next month, and we've already had some conversations on that at EMT. So I'll take the report as read, Chair, and happy to move to questions.
Thank you very much, Pete. Any questions, Philip?
Yeah, thank you for your report, Pete. Great, really interested to see what's going on. It's just about the adult ADHD and the 4 times the increase in referrals, and how we're getting on with talking with the whole system about a new commissioning model, because this is something, a pattern that's nationwide. And I'm not sure that it's going away anytime soon.
So
Lynn.
I'll let Lynn pick that up from the delivery group conversation that I know is taking place.
Lynn?
Yeah, so absolutely, as you say, Philip, we're not alone with this issue. Is very much very topically nationally at the moment as well. As Pete says, we have been picking this up and continue to do so through the delivery groups that we have in place with our commissioners, particularly obviously Hull and East Riding in this case. So we are working up proposals together that we will be considering, you know, where we go with those sort of later in the year, picking them up in the planning round too, is conversations that we're having at very senior sort of place director level, as you would expect, as well. So we are sort of hopeful that, you know, through that work, we will get to a position where at least we've got an agreed sort of proposal to pursue, particularly next year. But I'll obviously keep the board appraised of the work that we're doing in that area particularly.
Thank you, Lynn.
Yeah, thanks. I think it does say in the report that if once this new funding expires, it could deteriorate again. And I suppose there's a question about funding is an issue, but also just the way it's managed and who's doing what, the inputs into it from different partners. Can that be looked at as well? Francis.
That's part of the work, Caroline. It's not just about the trust position, it's about the whole system approach to this as well. So, but good point, thank you.
Okay. Francis.
Thanks, Chair. Again, I think it's a development of Philip's point. Again, great report, Lynn, on the waiting time, so thanks for that. But on quite a few of them, there's obviously a discussion about the future sustainability and money, etc., and need for discussions with the ICB. So I don't know whether it's you or Pete or a combination. You know, where are we on that? Because it seems to be a recurrent theme throughout that getting funding for quite a few of these services is key.
We're working very closely, Francis, if I may pick it up first, on those areas. As you say, they are predominantly the neurodevelopments, pathways and waiting times and memory assessment service, very much so. We've done very detailed capacity and demand analysis work, as the report says, and we're at the point, obviously, where we've shared that with our commissioners too, and now really having those conversations about the way forward, the proposals that we will work up together over the next sort of 2 or 3 months in order that we can answer that question. So I think it's important that the board is appraised that we have got that non-recurrent position, particularly in those neurodevelopmental pathways. The commissioners are very attentive to that, and as I say, we are having them at operational tactical level, but we're also having those at very senior level too. So I'm optimistic I will be able to come back over the next 2 or 3 months with, as already said, really where we're going next with this work. I don't know if Pete wants to add.
Yeah, I think you've summed it up pretty well. And I think what I would say, Lynn, is we almost have like a joint prioritisation model now with our commissioning colleagues. So it's not adversarial. We all agree what the priorities are, but I'm an accountant, I'm a pragmatist. We have to be realistic that we've got an ICB with a £30 million deficit, and minimal funding for growth. So there may be conversations we get into about reprioritisation of resources and what we deliver and what we can't deliver. We've just got to be brutally honest with ourselves.
But I think it's having public clarity, isn't it, Pete? That
yeah,
we need to be aware of that, and people need to be aware of that. It's not us; it's the fact we can't get the funding for it.
Absolutely.
Thank you. It would be quite interesting, Lynn. I think we've talked about this before. Maybe to know a bit more about, for those young people that are assessed, what does it break down in terms of the percentage and numbers that actually do require support around ASD? Yeah. The percentage and numbers who do then get moved on to the ADHD list, and then obviously others, and we've talked about this a lot, haven't we? There is something that child, young person needs support with, but it's not necessarily what they're being referred for. It'd be quite interesting to have a sort of snapshot of what that looks like, because I think that tells a lot about how there's a community of people involved in this, and obviously signposting families to where they can get support, and that can be done in real time rather than waiting weeks and weeks and weeks. I think I don't want to give you extra work to do, but I think it tells the story of some of the issues going on here.
May I suggest, Caroline, because at the June strategic board session, there is an element of that's on operational and waiting times pressures. I'm more than happy, obviously, to include some of that detail and data in that update, if that helps.
I think that would be really helpful for the conversation and discussion. I think that'd be really helpful. Right, I've got Dean and I've got Stuart.
Yeah, thanks, Caroline. I was just thought it was worth highlighting just a couple of the workforce stuff. I do pick them up a bit later in the workforce assurance reports, but worth noting here. So just we've reported now for a number of months about the statutory and mandatory training, so that essential training being above target. And just to recognise that I know that doesn't happen by accident, as it were, so it's about making sure that there's enough provision, both online and face-to-face training for people, but also operationally that people are being released. And given what Lynn was saying earlier, just to acknowledge that, that won't have come easy. So thank you for the work that goes on there to make sure we keep on top of that sort of essential training. And likewise, the sickness absence rates falling as well. So again, given the pressures, industrial action, all the stuff we've had over winter, etc., just a positive that's going in the right direction. And again, takes work and effort to do that. So just want to flag them here, that they are in the assurance report later, but worth noting in the performance report, I thought.
Thanks very much, Dean. Thank you. Stuart.
Thanks. Just to take us a little bit back to the ADHD discussion, two things, and maybe it's outside the meeting. I've been trying to make sense of what's the statistics which drives our overall kind of problem of waiting lists, and I think it might be useful to identify whether that is really primarily about ADHD, because those numbers simply dominate every other stat, don't they? So that's an interesting kind of observation on the data for me to kind of really understand a bit better. I think more generally, we've got quite a few examples coming through in the last 6 months of either through the specific provider collaboratives or through this kind of discussion at system level about how we're working with partners to solve what feel, or rather not solve, what feel like really intractable problems. And I think it's just us bearing in mind, how do we tie the threads together of what seems to be an effective or a not very effective piece of work at system level? So is it about relationships? Is it about resource redistribution? Is it about some simply honest reporting about what can or cannot be solved? I'm certainly in my role in relation to the provider collaborative going to keep that centre stage in our discussions in that subcommittee. And I think there's some good examples of that kind of microcosm writ large across the whole system at the moment, which is why, Michelle, I was asking earlier about the hard metrics of the ICB level plan. Is there something about now how well are we doing collectively to manage, if you like, the increasing demand that may or may not be matched by resources? I think it's just worth us keeping an eye on that as a board.
Thanks, Stuart. Very helpful comments there. Thank you. Okay, I can't see anyone else on this. Okay, thank you for that report. Let's move on to the finance report.
Thanks, Caroline. So I'll keep it brief. And firstly, apologies for the eagle-eyed amongst you that noticed the author on the reports, Michelle. It is actually me who wrote this. You know, I'd love to pass it over to Michelle every month, but I'll keep the reins on this one. So this is the finance report as at the end of April. It is a short report this month, and that's always the case in April because we're dealing with the legacy of year end at all. But key highlights a draw from the month one position are we did record a break-even position, which is consistent with our plan. You'll see our cash position remains strong, and cash is always a good indication of financial health of an organisation. And our better payment practice code was strong for April, which is always a focus for the national team. You know, at the moment, we are still continuing to work on our accounts, which are due at the end of the month, and we've got them later on in part 2. And we'll return to the normal, more detailed finance reports from month 3 onwards. So happy to take the report as read and take any questions.
Thanks, Pete. Any questions to Pete on the finance report? Steve.
Pete, just on the agency spend, did we commit to a target with the system around agency spend overall for the year?
Yes, we did 3.6% of the pay bill, Steve. So it's about, with the pay award going through, it's about 6.5 million for this year.
Just wonder whether it's useful to kind of show that on the on that target with spend, if that's our kind of target.
Yeah, we can. It's a good shout. We'll include that for future months. We did profile it as well. Sorry, I'm getting into detail a little bit, but we did profile it to recover, you know, based on our international recruitment trajectories et al. But yeah, I'll include that for future reports, Steve. It's a good shout.
Thanks, Steve. Francis.
Similar area, because we've looked at a lot of this at finance committee, but I just wondered, Steve, Pete, on the agency stuff. You know, are we out to with all our vacancies? Is everything up for vacancies at the moment? So we're doing our best to recruit to those positions.
Short answer is I don't. I'll hand that to Kwame, who'll probably know better than me for the consultant side, Francis, if I may. Kwame, are you okay to pick that one up?
Yeah, thanks. In terms of the consultant recruitment, we've had a lot of conversations. So there's adverts which gone up, which we hardly get anything. But in addition to that, there is approach to all SPRs or higher trainees in the region to make sure that we sell Humber to them. We're also using the international recruitment as a way to make sure that we can use other levels of medical psychiatrists so that we can use that to reduce our agency. And we're using skill mix as well. So there's a lot of ideas which we have been using over the last few months to try and make sure that we can keep our agency, especially for consultants and SAS, lower than we have now. It is hard because of the national recruitment situation, but we're working very hard to make sure we are not an outlier. Yeah. Does that answer your question?
Francis?
I think so. I think so. In effect, you're saying all the vacancies are out to advert. Then are you, Kwame?
I think we had everything on adverts. We had to pull 1 or 2 of them out because we wanted to update them. So what we're doing is updating some of the job description, but we currently have about 11 or 12 of the vacancies out to adverts, and we're hardly getting any responses through that route. So we're reappraising again that method of advertising, whether that is the best approach. We're trying to pull out our BMA adverts because we're not getting anything through there, but there's a lot of work going on to see which is the best way to attract doctors to this organization.
I know it's a tough area to get to, just so good to hear back from you. Thanks. Pete.
Yeah, thanks, Kwame. Thanks for that. I suppose also in some of this area, it's also what national policies are guiding how these agencies work and the rates that they're charging, where you need a bit of national oversight on some of this area. I think it's really difficult. Pete, sorry, you've got your hand up.
Yeah, thanks, Caroline. I was just going to make a suggestion that for the agency monitoring report we bring to EMT and then Finance Committee, we put a focus on consultant vacancies, just to pull out what you've said, Kwame, to identify where the vacancies are, where they are in the recruitment stage at all, just to give assurance that they are being advertised, or if they're not, why they're not. I think it just probably brings it front and centre, you know, based on the question Francis has raised.
Yeah, good idea. Happy with that, Kwame?
Yeah.
Okay, let's put that as an action then from this conversation. Can't see any other hands up. Thank you for that, everybody. Let's move on then to Freedom to Speak Up Guardian's annual report, and we have Alison with us. Sorry, we're running a little bit later than expected. Alison, over to you.
Okay, thank you, Caroline. Morning, everybody. Just before we start, I didn't know if Michelle wanted to say anything as the executive lead, speak up on the report, or do you want me to take everyone through the detail, Michelle?
No,
Michelle?
Yeah, I'm not on mute, am I? I'm on mute. No, I'm not on mute. That's absolutely fine. No, thank you. Just welcome, Alison. It has been through the executive management team. We would have obviously got it to the workforce committee, but I think just timings didn't work. So we thought, since it's been everywhere, we've sent it out by email, so it's here today. It does link into the national work as well. And I just bear in mind that this is a really small team, probably 1 and a bit people. So we are extending it now through the ambassadors. So got an absolutely huge team, but I think we have got a story to tell, so I'll pass over to Alison. So thanks, Alison.
Thanks,
Alison.
Thank you. So just before we start, though, it's just an amendment that needs to be made that Caroline's asked around the senior independent director, that Dean is the non-executive director champion for speaking up, and where it says chairman, we're going to put chair. So apologies for that, Caroline, and we'll make sure those amends are done. The kind of, hopefully everybody's had a chance to have a good look at the annual report. There is some national context on the current numbers nationally. We are waiting for the National Guardian's Office annual report, and if you look at our future plans, we will be looking at that once that is published. We do continue to review our data against the national numbers, so we have done a little bit of comparison against similar trust sizes and similar types of trusts, and you'll see from the numbers that we do, we have had a slightly lower annual number of staff speaking up. We don't necessarily think that's a bad thing. That could be seen as a good thing. We've gone from 27 to 23 this year, and we continue to raise the profile of speaking up across the organisation. I know that Michelle raises it on all of her blogs and communications that we do, and we're continuing to recruit ambassadors for the team. So we have had some additional resource, and Michelle recently has kindly agreed to provide some more resource for some admin support. In terms of the specific areas, you'll see there a breakdown of where we've had the speak up concerns from over the last 2 years, and the types of staff group that are reporting concerns, along with some of the kind of details around what people are contacting the Guardians with. We are continuing, as I said, with our ambassador programme, and we have had some initial feedback that people have thought that's really positive, because sometimes they maybe just want to speak to somebody that is familiar with them, that's working within their division, just for some advice and support. You will see from the staff survey that there's some positive upward trends around people feeling comfortable raising concerns, and the fact that they believe that the organisation takes raising concerns seriously. Some of the feedback that we've had is around perhaps some of the timescales things take to get back to people. So we have improved that process, working with Lynn and colleagues in the operational services. One of the recommendations from the well-led review was around collecting ethnicity and gender and age of those staff reporting concerns. We have struggled with that, to get that information, so we've now changed our processes from this reporting year to ask people, to try and encourage people to report that at the outset of them raising their concerns, as opposed to us asking for that at the end. So we're hoping that we'll be able to collect that information, so we can look across to see who is reporting and where we might need to be targeting different approaches to encourage staff to speak up. And there's just a piece at the end that talks about our future plans and what we're hoping to do for the next 12 months. So I'll pause there, and Stuart, you've been waiting patiently with your hand up. Thank you.
Stuart, thank you, Alison.
Thanks, Alison. Hi. Just a quick question about the table. It's on page 3 of your report. There's sort of breakdown by division and type of role who speaks up. It's always hard to tell, isn't it, whether you're getting too much or too little speaking up. Would you expect there to be a pattern correlated to either numbers of staff in each division or number of patients being seen or cases being seen that confirms this as a reasonable trend or not?
I think this is difficult to do, and that's why we're trying to triangulate and use other data that we've got. So information from the staff survey, which I know is broken down to divisions. We do tend to see more increased reporting in our mental health services than others, but you know, it is difficult to spot any trends. I think where we've now got ambassadors in our children and community area, so we're starting to see a little bit of an increase there. I think if we can make sure that we've got ambassadors in each of the divisions, that will probably help to create more opportunities for people reporting up. What we are seeing is, compared to last year, is we're having less people contacting us with concerns around their own sort of terms and conditions. So we're thinking that perhaps that we have got, you know, people are feeling more comfortable to do that through the other routes, because obviously speaking up is only one. So we're having to signpost less staff into our HR colleagues. But it is difficult to tell, and it is with such small numbers as well. But there's nothing that's sticking out as a concern. And conversations. Sorry, interrupt there. I have been to the operational leadership group. We've spoken at the senior leadership team, and I am going and speaking at team meetings in each of the divisions as well, because we are encouraging our managers and as what I am seeing where we have got concerns and we're contacting the relevant managers, that people seem a lot more open. They're more interested in now what is the actual concern as opposed to who is it that's raising it. So I think that openness and that culture, that's a real example of that changing as well.
Thank you. And then it's really interesting, you remind me that actually if people are using other channels, the normal, if you like, the management line channels to deal with things, that is a good sign as well, isn't it? So I guess the key is to kind of look for areas of silence where no one's saying anything. I suppose it's hard, isn't it, that? But it's okay, thank you for that.
Thank you.
Thank you, Stuart and Alison. Hanif and then Steve.
Thank you, Chair, and thank you, Alison. It's good to see that we're rectifying that anomaly where we're not really capturing information accurately around ethnicity, gender, etc. There just seems to be a slight disconnect there, because if we haven't been able to capture that as accurately as we wanted, but at the outset it said the majority of the complaints are coming from females. I'm just wondering how that's occurred, where we've managed to, as I say, accurately reflect that the fact that we're getting more female staff sadly coming forward. But later on in the report, as I say, where you've just alluded to, we're not really being able to capture those different characteristics on gender, ethnicity, etc.
I think we've still got more work to do in that area, to be honest. But we have seen that we have been able to capture the kind of gender reporting. But we've been doing some work as well. We are active members of the regional network, and this has been a challenge across all sort of organisations, and we are kind of working together with our regional colleagues to look at ways how we might be able to encourage people to report and the types of forms that we're using to collect that data.
Good. Okay. Thank you. Thanks, Alison.
Steve.
Yeah, thanks, and thanks, Alison. And I know, as Michelle said, you know, it's a really small team in trying to pull all this data together. So please take these comments with in the spirit that I recognise that. I do just wonder, just a couple of bits on the national. So nationally, there's some categories about recording freedom to speak up. So when you go on there, you can compare yourself to other trusts. They're done in those, you know, number of cases brought anonymously. number of patient safety well-being. I just wonder, Alison, whether actually us presenting our data in the same way as it's being presented nationally might be quite helpful, because then we sort of have that kind of compare and contrast. So just, it was an observation really when I was looking on the national site. I think it might just help us as directors particularly to sort of see those groupings about where they're coming, albeit that they're kind of small numbers as you allude to. And I guess the other bit for me was just, you know, when I read, and I know you're updating the strategy, aren't you? I know that's part of, that mentions in there. In the current strategy, there's 4 key sort of questions or statements that we say, how will we know that we've made a difference? And I just wonder whether presenting this report framed around those 4 questions would be helpful, because I think some of that's there. So improve staff survey scores, and by and large, I think that's in there and that's reflected, and it's a positive story. And even the one that went down was still above the kind of national average, aren't we? So I think there's something there, but there's certainly one there around kind of that it would be looking at patient complaints and concerns and seeing them reduce as a result of speaking up. So I just wonder if there's some way in structuring it where it links back into that overall strategy that we've set, whether that might just help with regards to framing this and showing the value and the undoubted value that it kind of adds to it. So they were kind of just 2 observations really, Alison, for structuring it going forward, rather than you know, I think it's all correct. You know what I mean? It's just maybe some suggestions that how we could do it for the future.
And I think they're really helpful comments. That's really helpful feedback. And we do, as they have changed the category that we submit onto the national portal. So they've now included sort of behaviours as one, which is interesting, and I think that's good. I think we can definitely frame it in that respect going forward.
Thank you. Thanks, Alison. Thanks for those contributions from board colleagues, to be helpful, I hope. And great, thank you. So are we, therefore, we're noting the Freedom to Speak Up report. Thank you, Alison. Well, you're here for the next item, and I'll see you later on today with Michelle and Dean as well at our catch up too. So we'll move on then, in that case, to item number 12, the Humber North Yorkshire Integrated Care System. Michelle.
Yeah, again, I'll just go straight over to Alison. This is our usual annual report. It is a bit of a lag, but it's just the way the system works. So Alison's just going to take us through it. We are the only collaborative at the moment that's doing an annual report, and probably about only the second in the country. So we're being used a bit as a template for that. And again, this is not a big, massive team either. But hopefully you can see the progress of the work, and we have some work to do in relationship to performance. I think we acknowledge that, but this is the providers across the system. So so I'll pass back to Alison to take you through it and answer any questions.
Alison.
Thank you. Thanks. So yeah, this is our, I think this must be our 4th annual report that was launched at our conference last year, where we had Professor Sir Michael Marmot as our keynote speaker. I really hope that everybody's had an opportunity to link and look at the annual report, because I'm really proud of it, and I think it's a real success, and there's been so many achievements, which just shows the power of working as a system and how well our collaborative is working for mental health, learning disability and autism. So it's a real team effort from all of the providers and those working at place and our voluntary sector providers. Just wanted to pick out some key highlights from it. The Youth Justice Programme, which is we're one of 10 national vanguards in the country. We are leading the way on that, and this is about providing support to children and young people who are at risk of entering into the criminal justice system. So this is our work in relation to early intervention and prevention. And we already have now seen over 500 children and young people receiving support and going through that process, and we're seeing some fantastic outcomes from that. The work that's been done on suicide prevention, where we've now got over 20,000 people trained on the top suicide, and the establishment of the Bereaved by Suicide programme in partnership with Mind, and all of the work that's happened with our public health colleagues working in local authority. I think the challenge around serious mental illness and the physical health annual health check monitoring, which is a national priority from the long-term plan, where we had a significantly low response. That's been a massive effort, and we're seeing some really good numbers there. I think we're now at nearly 58 when we started from about 25%. Obviously Humber have been leading the way, Humber Trust, around its transformation of community mental health teams, and that's recognised in there. And the 24/7 access, crisis line access for all ages. Again, all of these are the priorities of the National Long-Term Plan. And then I just wanted to mention the really successful programme of clinical assemblies that we've had, trying to get our involvement of and influence of our clinicians. This is a programme that's been led by Dr. Stella Morris and Dr. Steve Wright, which we've had really fantastic feedback on. So I could go on, but yeah, that just captures some of the key successes. So to take any questions, thank you.
Thanks, Alison, and it's a really interesting report and looks and reads very well. Any questions to Alison on this? No? Okay. Satisfaction with that. Carry on. Oh, Stuart.
Sorry for the late hand up there. So, Alison, right. Really interesting report. It comes across in a very positive spirit, which I like. 2 questions. Just kind of a procedural one. Why is it so late in reporting? And are you sort of on with the year that's just finished report? And back to something I asked earlier in the meeting, are you able to, from the experience so far, are you able to start to distill the really key ingredients for successful collaboration that's not only just about relationship building and kind of well in good intention, but actually very, very demonstrable impact on improved service or reduction of waiting lists or better use of resources? Are you getting a sense of that?
Yes. So just around why is it so late? We probably need to get back into the earlier cycle. And Michelle did say, isn't there another one report? And I said, no, well, we launched this in November. And this is because we started this when we first started the collaborative. So yes, there will be, there is another, we are planning our conference and it will be launched then. So yeah, in answer to that, but it's not late, it fits where it's been, but we need to get into the better reporting cycles. I think, I mean, you probably know this, but we can't underestimate the amount of time it's taken to get our collaborative to this position. And the relationships that have been formed and the trust and everything else that goes with that in terms of those ingredients that make a successful collaborative. I think we've also had that in the context of the transition to the new integrated care system. So we're still working through that new operating model and the role of provider and the role of place that we're as commissioners, and how we're all jointly sort of getting our heads around that and working collectively together. I think the strength that we've had from a mental health and learning disability autism is our NHS national long-term plan and all the priorities that go to support that, where we definitely have seen tangible outcomes, and the work that we've done at the collaborative level, the transformational work has been where we can make a difference at scale. So like the community mental health transformation, like the physical SMI, physical annual health checks, like the youth justice programme, but that doesn't mean that we're taking away the work that needs to happen in local places and neighbourhoods with their local communities. So it is kind of like a jigsaw that we're building, but I think we've got all the ingredients there. So I don't know if I answered your question there, Stuart.
You did. If I play a little bit on some of this, it fits what you're saying is that so relationships are key, and a kind of the time it takes, which suggests that the more that we can do to ensure stability of roles, personnel, and not changing kind of structural things helps.
Yes.
Does that, if I've understood correctly what you're saying?
Yeah, that's absolutely correct. I mean, the only one of the challenges that we do have is some of the non-recurrent nature of the finances and how the finances flow, and that's something that is on our kind of plan that we're looking at as we go forward, and that might be something that Michelle wants to comment.
Well, that's the counter side of unpredictability, isn't it? So unpredictable numbers. Thanks for that. Thanks, Caroline.
Okay. Sorry, Michelle, did you want to come in?
Yeah, no, it's a really good point, and yes, I suppose it's frustrating that we have lagged behind, but we're in that process of catching up from a year point of view. But it was from the start of the partnership, because this started before collaboratives came on board. If it precedes a lot of the board members, to be honest, in a partnership that I started a long time ago. And I think the key point is, and I think hopefully that's to reflect in the document, it is about that relationship piece, because the whole system runs on relationships and behaviours. And I think we've managed to really steer the collaborative into a really good place. Yes, we've got our challenging moments and our challenging conversations, but I think the trust and the confidence is there in relationship to us going forward. So, and that's in part down to Alison and the team. I think the sticky bit at the moment is things from a non-recurrent point of view, and how we do that with the developing efficiencies that we've to make, but also with the developing place alongside the ICB as well, which is what we're dealing with at the moment. But I think we've got such a stable ship. I think hopefully it will be just a bit of a bump in the road, which we've had a few of those. But thanks for those comments. Really helpful discussion.
Yeah, thank you, Michelle. Thank you. I would just ask, and it sort of links to Stuart's point as well, is that obviously these annual reports, they are annual reports. We will get one next year. I just want, for me, annual reports generally, it's not just this one. Obviously, we want to see all the positives and the successes, and that's, you know, that's there in the report. But I suppose I'd also be interested, if I was looking at this report in a year's time, of all the objectives for the year it's saying looking ahead, is, you know, the next report to reflect, well, maybe some of the areas we weren't able to achieve, and there might be very good reasons for that, and just where, you know, things didn't work out, and where there needs more work to be done. And maybe something, because this is a collaborative report across a huge area, I think it's sometimes also worthwhile just having a sense of what is the demand we're talking about in the context of all this, because I know when I meet with the chairs of other provider trusts, particularly ones that obviously have a similar remit to our own, we are always talking about the demands in some of these areas that the report covers. And I just think that sort of, you know, having something like that for those people reading it, you know, we do need to make sure that we're aware of the challenges, and also sometimes where projects maybe didn't work, or they need another year to work to get to where we need to be. That's really sort of my only sort of comment, sort of looking ahead, so that we have that's not missed in all of this. Because, you know, you might look at this report and think, oh my goodness, everything's working, it's all good, you know, but we know there's massive challenges out there, and keeping the push on the collaborative to work together to resolve this, I think is really important. I hope that's helpful, Alison.
That's really helpful. I mean, the other thing I just wanted to talk about around relationships is that the fact we do have a good relationship with our colleagues in NHS England as well, the national and the regional team. And I just wanted really to acknowledge the support of Pete, who works tirelessly to support us in the collaborative, and Michelle for her leadership. So, but yeah, really helpful comments. Thank you, Caroline.
Thanks very much, Alison. Let's talk about, I think you said, Michelle, we're the only collaborative providing this sort of annual report at the moment. I think you said that, didn't you, Michelle?
Yeah, at the moment, the idea is I'm working on that all of them providing something similar. But the other thing is that this is used nationally now as a template of good practice. So
yeah, that's great. So we are innovating, leading from the front on this. That's fantastic. Thanks, Alison. Thanks for the. See you later on today.
Thank you, everybody.
Cheers.
Thanks, Alison. See you later.
Okay, moving on then. So we'll push back our break a little bit, and we'll deal with the next two items. So Lynn, emergency preparedness, resilience and response.
Thank you, Caroline. Yes, so this is our annual report reporting on the work of the last year. It's obviously been a further challenging year for our emergency planning, response and preparedness processes, but hopefully the report demonstrates that we've made good progress over the last year. It recaps on the work that the board saw last autumn on our assessment against the national core standards. We've obviously got a detailed action plan in place in relation to that. We've taken the opportunity to really look at some of our significant policies and procedures in relation to this work as well. So the report details where we've revised those and obviously taking into account the lessons, particularly from COVID, but also in relation to the industrial action as well. It demonstrates where we participated in exercises. We are required to do that too, but I'm happy to leave it there, Caroline, actually, and hopefully people have digested it. Really happy to pick up any questions.
Thanks very much, Lynn, and I've seen good work, Lynn, from Stuart in the chat box there already. Quick on the keyboard. Francis.
Yeah, just a very quick one. A great report, well put together. Good to see the internal audit that's coming through in terms of governance. I just wondered if you could remind me, do we have a NED linked to this? We
do, and it's Mike Smith.
Right,
and
great,
the report was shared with Mike, so hopefully he's had a chance to have a quick look over it.
Thanks very much.
Thank you, Dean.
Yeah, thanks, Karen. Just acknowledging the work of the team. I know this is the annual report and particularly picks up on COVID and lessons learned from there, but know also that during industrial action, they've played a crucial role throughout the work that's been doing across the ICB. I just wondered, Lynn, whether it was worth, I know that the national COVID inquiry is underway or about to get underway, and whether it's just worth sending off these sorts of reports into that inquiry, just as you know, our sort of experiences on the ground. It just you know, a bit of added context for people to do something proactively.
That's a really good point, Dean. Thank you for that. I'll certainly follow that up. Thank you.
You will take that as an action then. Thank you. Okay, I can't see any other hands up. Thank you, Lynn, for that report, and we'll action that idea to send to the COVID inquiry as well, some of our context of what we went through and how we dealt with it. Thanks very much. We'll move on now to the Health Stars annual report, and we have Jamie Lewis has had to apologise, he can't attend, so we've got Claire Woodard, head of Smile, and Tracy Woodward, the business manager, and Steve's the lead on this. Steve, over to you.
Yeah, I'll just do an introduction. So thanks, Caroline. Yeah, and welcome Claire and Tracy. So this is the Health Stars annual report and the fundraising plan that was considered at charitable funds last month. And signed off at charitable funds by those that were present there. So it's presented to board for information. Claire and Tracy will be able to answer any detail, I'm sure. Claire, putting you on the spot there if people have any detailed questions. But I think probably the best way is I'll throw to Claire just to do a quick overview and then take questions from there, Caroline, if that's okay.
Thank you very much, Steve. Claire, welcome.
Thank you. Thanks for having us. Yeah, so this is the annual report for Health Stars for 22-23. I'm hoping that you've all had a chance to read through the report, but I just want to pick out a few bits if I may. Obviously, the last year has been a challenging year for the NHS in general, and you know, Health Stars has been part of that journey, and it has been a challenge. And we're the first to recognise that there has been some shortfalls, particularly in the fundraising targets that were set. But what I would like to say is that thanks to a new SLA that we've been signed off by the trust, we're now in a position to be to really look forward and to really kind of reignite the charity within the trust. Obviously, the COVID pandemic did impact the visibility of the charity as well as our opportunity for in-person engagement and fundraising events. However, we were able to be successful with some of our events which took place in the summer last year, notably the CEO Challenge, which Michelle was involved in. Again, we're building on this success. We're the first to recognise there are some gaps in our performance, and working with the trust, especially the exec leads, we have got a new set of KPIs in place now to really move this forward. One of the success stories, just to share with the trust board, is that we've been successful with a grant from NHS Charities Together. So the charity has been awarded £30,000, and this is to help develop the brand, the charity processes, and the strategy across the trust. So that's something that we're working on at the minute. Continued thanks go to Michelle, a CEO, and the exec lead Steve, and the finance team for all their support that they give the charity. It's really is appreciated. Looking forward, as I mentioned, we're looking at kind of relaunching the charity across the trust, doing a lot of staff engagement, We're looking at new presence on social media, as well as a new updated website. One of the things that I really want to focus on is getting staff engaged on how they submit wishes into the system. There's quite a lot of work to do in terms of communication and making sure that people know how to engage with the charity, and making sure that people follow the right processes, so we know exactly what is being asked of us, and we can really support staff in that. As part of this kind of progress report, I have actually put together a really detailed ops plan, working plan, and this is going to be my month by month work plan for the charity. We're looking at different fundraising streams, we're looking at corporate engagement, we're looking at working with local VCSE groups on how we can really implement the charity, not just across the trust, but across the whole ICB as well. So there's a lot of work there, quite a bit of detail within that plan, and I do appreciate it's a tiny font to read, but that is my kind of day-to-day working plan, which we're hoping we'll be able to deliver on the KPIs that we've been set by the trust.
Okay, thanks, Claire. It is a very tiny font on that. Yeah, I'm a bit big on fonts. They've got to be readable on a screen. Okay, right. Thank you very much, Claire. Any questions from colleagues? I've got a couple, but let's see who else has got some questions. No? Okay. Stuart.
Well, it kind of comes up in my later report back from the Charitable Funds Committee in May. So we did look at the hard to read document in quite a bit of detail there. I think it's fair to say that this report kind of puts to bed the last year, which none of us are happy with. And we all know that, and we're going to cut the new SLA in place. We've got a new plan in place, and we've been looking forward to an improvement in performance, particularly around fundraising. And just to say, Claire, you and I have been in email traffic the last couple of days. I went on a visit last week, and another example of a wish that had been submitted and somehow got lost in the system. So please do keep your eye on that and work with trust colleagues to kind of really get that process understood, efficient and clear. And I'm sure that will help generate interest and engagement in the activities. And then the other thing is that you mentioned it does seem to be, doesn't it, that our financial success is very contingent on you bidding for funds from institutions and grants, as opposed to kind of the individualized fundraising. And I'm looking forward to kind of you bringing home the well, I'm a vegetarian, I say bringing home the bacon, but producing the results on that.
Claire?
Yeah, that's great, Stuart. Thank you. One of the things that we are really keen to work on is the communication with staff, and really reiterating that, you know, it is an easy process to submit a request for the Circle of Wishes, but it's got to be done in the right way, because like you say, Stuart, things do fall down the cracks, and you know, we just need to make sure that process is followed.
Okay, thank you. I've got a couple of questions. Just could you just sort of let us know, just in terms of the future, how much are you expecting to raise in the next year?
We've got a target of 150 for this year. I've split that up over the months, and like Stuart mentioned, one of my main aims this year is to really focus on grant applications to trusts. What I really want to do as well is focus on the wishes and the requests that we've got in the system, and link those applications to the existing requests that we've got in. There are some pots of money that are underutilised, so we're doing some work there with the Fund Guardians about how we can best put a strategic spending plan in place for that money. But there's also some fund zones that are quite low. So again, it's about really targeting where we need to make the income and putting those grant applications in.
Okay, and what about in terms of reaching up into the wider communities that we, you know, sit within as well, and those people who might, businesses and others who might also want to sort of support the trust?
Yeah, so that's one of my main aims as well, Caroline. So I've actually been speaking to the Fund Guardians right across the patch. So I was in Whitby really recently last week, speaking to the team up at Whitby. I'm going to Malton on Friday, just to really kind of make the Health Stars message right across the trust. I don't want to be focusing just on the kind of whole-based teams. You know, it's really important that we get to all the community sites and make sure that everybody is aware of what we do. So there's a big piece of work there to be done, because I appreciate the huge, you know, the huge patch that we operate on. But as long as I can get a consistent message out there, and we're regularly communicating with staff, we're using the tools that we've got available, kind of the global, the intranet. And I think we can really try to get that message out as far and as wide as we can. In terms of the corporate support, that's one of the things that I really want to look at as well. Getting some really big corporate sponsors behind us, not just the traditional suppliers that we've worked with over the years in terms of the trust, but also some new businesses who really like what we're doing as a trust, and get those on board as well to support us financially and voluntarily as well.
And you were up at Whitby last week. How many people outside of our staff did you manage to get to celebrate to?
So I spoke to 25, 30 people, give them all a leaflet, really engaged. You know, we spoke to one lady who owned an Airbnb. She was taking information across there. And I think it was just nice that we had a presence there, and people knew that, you know, the Whitby, you know, appeal, if you like, was kind of reignited. And I was there on the ground to be able to take any questions.
Okay, thank you. Steve?
Yeah, thanks. And it's interesting, Claire, I'll pick up with you about presentation that we had earlier. So I do think there's 2 points really. When we talked about the review of the year, Stuart and I have had a few conversations around this. We all said that we would also all commit to support this and making it work. And I'd reiterate that message to everyone on the call and anybody listening in. Staff have to make this work, so staff have to get behind this and support it and fundraise and help Claire. Claire can do so much with regards to that, but we do need to energise. Staff do need to get involved. They can fundraise for their particular zones. And just finally, on the wishes issue, so, you know, Claire and the team don't make decisions on whether we spend money or not, or our zone managers do, and all the zone managers are employed by the trust. And I think sometimes that, and this is part of what I know Claire's getting around and talking to people, so I think there is a little bit of maybe just re-educating across the whole organisation about that kind of process, and people understanding that actually, you know what, it's probably your manager that holds the zone, so they're probably very likely to sign it off if you put it in there and you make a compelling case. So do so. And I think that's a little bit of what Claire's having to get around and do a little bit of that kind of education, and everyone on this call can do that as well. And I know we've started to see some things coming through from visits, which is great. So yeah, just to sort of capture those points, and Claire will pick up on the kind of forensics conversation that took place earlier as well. I'll catch you on that.
Okay, thanks, Steve. Well, look, we are out on visits and we are picking up this message, and we'll continue to relay it back in where we hear it. And of course, beyond our own staff, it's obviously the wider public. You know, we want everyone who lives in the area we cover, not just those who work for the organisation, to have some communications to them too, to get involved as well. So yeah, okay. I can't see any more hands up, so thank you very much, Claire. Thank you, Tracy.
Thanks very much. Bye-bye. Bye-bye.
Okay, so let's do the report on the use of the trust deal, and then we'll take a break. Michelle.
Sorry, just taking myself off mute. Yes, this is our annual report in relationship to how we've used the trust deal. I think hopefully it's self-explanatory. It's all followed the due process, usually for estates, facilities, etc. It's in line with the trust standing order. I think it's about section 8 of the standing order, and there's a list there that of the numbers and the references that we've done the sealing on. So if there's any questions for anybody, but it's asked to note the use of the seal. Thanks, Chair.
Thank you, Michelle. Any questions? No, is that noted? Thank you. Brilliant. Okay, let's take a break. We will now stop live streaming, and it is 11:19. Let's get back at 11:25. Okay, welcome back to Humber Trust board meeting. We are on item number 16, review of standing orders, scheme of delegation and standing financial instructions. And we've got Stella. Stella, please.
Hi, yes, thank you. These are here for approval. They've had their annual review. It's been quite a full review. A number of small changes have been made to them, such as changing NHS Improvement to NHS England and correcting a few small typos. And then there have been some more sort of material changes, and they're referred to in the paper in a bit more detail. They have been to the audit committee, and as I say, they're here for approval.
Thanks very much. And yeah, Stuart is nodding. They were at the audit committee and I was there as well, and there was a good go through there. Any questions for anybody about any of the changes or comments, please? No. Is everyone in favour of approving these document with these amendments? Yes. Thank you very much. That's approved. Move on then to the annual declarations. Over to you, Stella.
Yeah, so the board's already seen these in January, made some comments which have been incorporated. They went to the Council of Governors on 20th of April. There was one challenge made about the reference to good assurance provided by the internal audit in 1819. And I'm asking the board whether they think that should be removed. But it's here for approval based on the assurance detailed in the report. And if approved, we will then make our self-certification and upload that to the website.
Yeah, thanks, Stella. I mean, on that question that was raised by the governors, I sort of read through this document. When I read through this document, my sense was, even though it was a reference to 1819, I think at that time, wasn't it the case that that's when the procedures were sort of put in place, and so the procedures are still there? I think I read it as saying, you know, we are working to these procedures which give us this good governance, and they are still here. Maybe there's a phrase in it that says we are continue to use them. I wasn't there at the time, but that's how I interpreted it when I was reading it. Pete, you might be able to help me out.
Yeah, I think you're right, Caroline. I think in 1819, the internal audit reviewed our committee effectiveness reviews and the process we've adopted, which we've continued and continue to report to this board on an annual basis. And we got significant assurance. So, you know, the internal audit plan's informed by risk, and at no point have the auditors looked at our organisation and thought we should review your committee effectiveness processes because we're following what we did before that got that level of assurance. So I think the comment still stands, but can maybe be elaborated on a little bit to provide what you've just said.
Yeah, that's sort of what I was thinking. Stuart.
Yeah, I agree with that. Two things. One is the internal audit program is cyclical as well, so it might be reviewed at some stage, but the timing of it is not now. And I think if you look at in the context of having the very positive, well-led review, that also endorses the governance arrangement. So I think it's completely appropriate to include a reference to an internal audit from 1819 because it's part of the cycle of review.
Okay, so I think there is agreement we should keep something in. The only thing is whether we want to just add a word in there to just reflect that this is ongoing. What was there and approved in 1819 continues to be the case. If that's helpful. And the only other point I had to make was on the training of governors. I just wondered, in addition to that list that you've got, Stella, there, governor induction program, government development workshops, council of governor meetings, we also do share with governors access, to external governors training programs. Obviously, it's not mandatory, but we do share information on that with governors for them to take up as well. I just wondered whether it's worth adding that onto your list of 3 there. What do you think, Stella?
Yeah, I think we can add that. Yeah.
Okay, thank you. Any other comments then from any other colleagues? No. Okay, therefore, with those changes and affirmation to keep the reference to the 1819 review of our assurance procedures in terms of effectiveness, that is approved. Yes? Great, lovely, thank you. Provider licence, back to Stella and Pete.
Yeah. Do you want me to go first, Pete?
Yeah.
Yeah, okay. So we've been issued with a new provider licence. There are some changes to what we need to do that are reflected in that paper, but they they relate to effective system working, enhanced oversight, climate change, and there have been some technical amendments. From next year, from this year, actually, we do not need to self-certify or to publish a self-certification, but the board is expected to seek assurance that we continue to meet the requirements of our provider licence. So we are currently gathering all the evidence in relation to the new elements to it, and we plan initially to present that to EMT, and once we're happy with it, it'll come back to board for you to say whether you're assured with the evidence that we've pulled together. So it's just there for noting, really.
Okay. Any questions? No, thank you. That is noted. Thank you. We now move on to the board and committee effectiveness reviews, for 22-23. Stella?
Yeah, so this is the annual item. It is good practice for the board and its committees to undertake an annual review of its effectiveness, and that is a requirement of the Code of Governance as well. So each committee and the board has done that. The reports are here for noting, but at the same time, the terms of reference have been reviewed. A number of big changes have been made. The majority have been agreed by the respective committees, apart from there's been one change to the Remuneration and Nominations Committee about severance payments, and there's one relating to the Finance and Investment Committee, which due to timing issues didn't go to the respective committees, but they're all here for ratification of the board.
Yeah. And again, that one on the Remuneration Nominations Committee went to the Audit Committee, and there was discussion there added to that. Stuart?
Yeah, thanks. Just one question on these. It's probably for you, Dean. On the review of the workforce one, in the the potential actions and further issues. Is it deliberately a blank column? And I'm not saying there's no room for improvement in the work of the committee, but is that a deliberate? We've reviewed it and we don't feel any changes or improvements are appropriate. Hang on, Dean, you're on mute.
Sorry, I'm just trying to look at it on my screen at the same time as is it the column on the actions?
Yeah, so it's page
outstanding issues
357 of the pack, and it's the outstanding issues action plan. I just want, so as the audit committee is the oversight function for all the subcommittees. I just want to make sure that the kind of review is it kind of a positive nil return, if you see what I mean.
Yeah, I don't know whether it's just been missed out, Stuart. So can I double check that? I'll pick it up with Steve after this meeting and see whether we've just left it blank or whether it was intentional.
Thank you.
Okay, thanks very much. Any other questions or comments? Steve?
There was just, Stella, there was just something that I sent through on the REMCOM terms of reference yesterday that I'm not sure it had picked up from the May 22 REMCOM. I sent it through to you and Jenny, just some wording on that, and I know Jenny had picked it up this morning. Did you get sight of that?
Yeah, I have seen it, Steve. I had a chat with Jenny because I couldn't understand from the wording, so I think Jenny's just going to come back to you to refine the wording. so that we can drop that in there, unless you want to just repeat what that is here so that the board can approve it now.
Yeah, there was wording in that document of the 22nd. Is it? I'm just trying to think. It's quite. I've got it up in front of me. Is there an easier way for me to pick that up, given it's?
Yeah, I don't think it was quite straightforward, was it, from the wording? So if you want to do it afterwards, and then we can bring it back just for ratification to the next board.
Steve? What is it? What you wanting?
It was just as a REMCOM, you agreed some words, and I think it was actually Dean's words that were put in, and it was to agree for those to be picked up as part of the terms of reference going forward, and they haven't been written across as they were recorded. So it's around the remuneration, it's around the R&R payments 4 years, and it was also around kind of reporting consultant roles into board. So it's just that those words haven't been picked up in this iteration. So I think there is a little bit of tidying up there to do. Whether we can pick that up in REMCOM maybe next, or whichever way. But okay, I'm just conscious that it didn't read across.
Okay. So in terms of where we just are at this moment, we just obviously need to check, because lots of us aren't in the know of what this is. We just need to pick that. We've got a REMCOM later on. Perhaps we can just go back to it when we get to REMCOM later. And if there are any more changes to make, we'll have to make them. We'll have to make sure that that's explicit in the terms of reference. Hanif.
Thank you. Semantics, but where attendance is shown for committee members who have joined committees partway through the year, for example, workforce development, where me and Philip have come in, at first glance, it just looks like we're missing meetings. And as I say, I know it's semantics, but no,
it's really important.
It's a sort of minor detail people do tend to pick up on from my past experience. So it looks like, for example, I've only attended 1 or 4 meetings, but
sure.
I think there's only been, well, now there's been 2 since the report's been published, but might just be helpful that I know it's a minor detail. But
perhaps we could just put in brackets. The date you joined the committee or something like that, for that, where that's the case, to make that clear.
Thank you.
If that's helpful. Stella.
Yeah, you'd normally put, so if you could only join 2 meetings a year, you'd put 2 out of 2 rather than 2 out of 4, so that it makes it obvious that way. That's normally how you'd record it.
Brilliant. Whatever works best, just to show that, clearly nobody has been shirking, and just to make sure that's your suggestion sounds the most straightforward way to do that, Stella, actually. Okay, fine. Okay, subject to resolving this situation around REMCOM and just checking on the wording of that, are these committee effectiveness in terms of reference reports approved by the board? Yes, great. Thank you very much. Thank you, Stella. We now go on to the fit and proper persons regulation. Obviously, this requires all trust to ensure all executive, non-executive directors or anyone performing similar or equivalent functions are filled by people that meet the requirements of the FPPR. All due process is done. All those effective have been contacted to make sure these are up to date, and it seems to be all in order. So it's just for this board to note. Any questions or comments? Nope. Okay, thank you very much. So we move on to appointment of associate hospital managers. Kwame.
So, I mean, this paper again is to on the same principle which we agreed previously about improving diversity of the associate hospital managers. We have been successful in recruiting 2 members, and they have been vetted. We are in the process of having training, and was bringing the paper here for ratification of the board. Mike has been involved in this discussion. Mike, is there anything you want to say about this? any question.
Okay. I think I don't know if there's any question. I think it's been fantastic, this piece of work. I think looking out beyond, possibly the usual people might consider applying for these roles. I think it's been really creative. I'm really glad that our university contacts have been involved in relation to this as well. So I just want to say that to you, Kwame, and Michelle Nolan, and also Mike Smith, who I know has been really supportive of this too. Congratulations, well done. Any other questions or comments before we seek approval of Jamal Chowdhury and Anthony Shidera?
I don't know if you can see my hand, Chair.
Mike.
Yeah, very supportive of this report, very supportive of what you said. It is important, though, to recognise that we have existing associate hospital managers who've done long service for us, and I think it's really important to communicate with them proactively about the reasons why we've done this. This isn't pushing people's nose out of joint. This is increasing diversity for the good of the trust and the good of the population. But we're not throwing the baby out with the dishwater. We've got a good bunch of associate hospital managers with us already that we really need to keep on board.
Absolutely, Mike, and they can share a huge amount of their knowledge and experience with the new intake, if that's the right phrase, into our ranks in this area. Kwame and then Michelle.
Yes, Michelle. Sorry, Caroline. Mike, I have actually written to. I probably will share the letter that I wrote to the other hospital managers. I've written to them to make the same point you are making, to appreciate the work that you're doing, and to explain to them what this is about, is to strengthen our ability and our offer to patients and to increase diversity, and it's not a sliceman. And also part of the letter, which I would ask my PA to send you, is to say to thank them for all the hard work they're doing and continue support.
Thanks, Kwame. Michelle?
No, just to say thank you, Alex. It's one of the things that I think I constantly mentioned and raised about getting diversity within the associate hospital managers. I appreciate what Mike was saying, that we've had a lot of really, really loyal folk, which obviously we'll continue to do, which is great. But we do need that the turnaround and the fresh viewpoint, as well as that balance is really important. But more important, the diversity. It's really, really, really positive, because I know that it is a difficult ask in relationship to the role, etc. So thank you all, and let's continue to get that diversity, because it's about all the different diversity of our communities as well. So great to see, and I'm very, very supportive of it.
Brilliant. Thanks very much, Michelle. So without further ado, is the board happy to approve the appointment of Jamal Chowdhury and Anthony Shidera? Yes, great, and welcome to them. Moving on then, we go to the Assurance Committee reports. We start with you, Francis, please.
Thank you, Chair. Good meeting. We discussed last year and also the plan for 23-24. We're delivering. We've got a good positive cash position. BRS continues to be delivered, which is excellent. And the financial plan and BRS plan for next year have been agreed. So it was a good meeting. The only areas that we flagged that were a risk were not so much ourselves, but more the wider NHS and ICS and the implications that might arise from that because of the level that's going on. And we did pick up on agency spend and the current deficit position of primary care. That's the key things to bring out, I think, Caroline.
Thanks very much, Francis. Any questions or comments to Francis? No, thank you very much. That's noted. Moving on then to Workforce and Organisational Development Committee, Dean.
Yes, thank you, Chair. The report's there for noting. I picked up on some of those issues earlier when we did the report, but some positive assurance that we've got there. Also highlighted some work that's commissioned underway, just looking at some of those hard to recruit posts. Francis alluded to earlier, things like sort of consultants, etc. So we'll be reviewing some of those reports at the next meeting. And then just in terms of the sort of decisions made, those risk issues, is looking at sort of that primary care recruitment remains a risk, those vacancies that we've got there. And then also just in terms of the rostering arrangements, just making sure that we remain on track with that. So some good progress made, but recognise it becomes harder as it goes on. So executive team will keep an eye on those issues, but happy to take any questions.
Thanks, Dean. Any questions? No, thank you very much, Dean. That's noted. Stuart, Audit Committee.
Yeah, just go back to workforce. It's good to see that the vacancies dropped below 10%. That's really good work there. So turning to Audit Committee now. So a couple of things. One is very, very positive, a long list of positive assurances once again from the Audit Committee of May, across all fronts. And so that's really, really good to note the continued strength of our internal control system. One thing I need to point out is that when we met, we believed that we were correct. It turns out we weren't correct on the day. So what we're going to do is just at the next meeting, which is on the 20th of June, is just ratify the decisions made that are in the box today on decisions made. By the way, some of which are coming to today's and this afternoon's meeting of this board, so that's fine. So nothing really to report apart from good stuff. And we'll be meeting again, as I say, on the 20th to do the really, really big piece of work on the annual report and accounts and complete some of the discussions we started on the 16th. It's worth saying actually that the Audit Yorkshire, our internal auditors, unprompted described the trust's internal control regimes as exemplary. And I don't think we should simply take that for granted. That is a very, very strong endorsement. So let's keep it up. Well done, everyone.
Thanks very much, Stuart. Cheers. That's great. Questions? A round of applause emoji going up there. Thank you very much. That's noted. We move on to the Collaborative Committee report. Stuart.
Thank you very much. So this report's from the meeting in April. Again, a couple of things to pull out from the summary report that covers it. One is on Mill Lodge. The team are working on an alternative to services, an alternative to hospital admission. So this is for CAMHS patients, and again, I think a good example of the fact that we've identified a kind of a blockage and trying to find a way around it by reconfiguring services or facilities that we currently have, which I think is to be encouraged. And then the other thing, one of the key risks area of focus, again, to do with CAMHS. So we're identifying a reasonably large number of out of area bed days. And so I'm kind of also starting to think with the team about, well, what does it mean? An out of area placement is, it's not ideal, but if we haven't got a facility in the region, then it's inevitable that the best place is out of area. So it kind of we kind of got a series of KPIs that might draw our attention to something that we might need to rethink how we consider that some of these stats. On the whole, though, from this work, I'm seeing, echoing the discussion we had earlier in this meeting, I'm seeing a lot of collaborative work, which is creating good relationships, understanding the kind of the cross-organizational links between services and demand, with still some way to go. But I feel that kind of the collaborative arrangements have really settled down, and we're now going into the performing stage as opposed to the forming stage much more. I'll stop there.
Thanks, Stuart. Any questions to Stuart? No, thank you very much. Moving on then to Mental Health Legislative Committee, and I think Kwame, you're going to speak to this. Yeah,
thank you, Carola. So this committee continues to meet, and it is quite a strong committee with a lot of challenges, and I think the work goes into the heart of the care to patients restriction, and we do keep an eye on the trends and things going. So the report includes some positive assurance and some work underway. So in terms of positive assurance, we have looked at restrictive intervention, which I suspect members of the committee would be keen to know that we are monitoring that. We also continue to look at the 136 figures to make sure that we are not an outlier. there was a report on ethnicity and mental health, which is always national and topical, which we had a lot of debate about, and assure ourselves about the trends and to keep monitoring that. And I have mentioned the associate hospital managers, the positive that we have achieved through the diversity and recruitment. CTO is also something that we do monitor quite frequently, and we had a report on MAPA. And most importantly, most of our mental health legislation, policies, and guidance are all up to date, which we keep an eye on frequently. And the work underway is listed there, and some of the decision making has also been listed there. And I think that the body of the report is as read. Thank you, Caroline.
Thanks very much, Kwame. I know you were doing it on behalf of Mike today, stepping in. Thank you. Any questions? No. Okay. Charitable funds, Stuart.
Yeah, thanks again. So you've seen quite a lot of this, the content of this report in the annual report we've just seen from Claire Woodard and colleague. So I'll just pick out a couple of things. So it's important to realise the new SLA is in place, and the key performance indicators, which you recall have been simplified, are still under watch. So there is a kind of waiting and watching and seeing moment right now. What's encouraging for me is there's good evidence of more engagement with the fund zone managers, so those people who look after funds already raised, and Claire is making her way around those folks. One thing just to keep on your radar on the risk side is that the Newbie Trust pledged £50,000 for a garden project at Inspire, which is not made the speed of progress what you'd want, and so there's some work in hand to keep the Newbie trustees on side so we don't lose that pledge. Otherwise, you're pretty familiar with where we are in this arrangement, and we'll be keeping a close eye on it up to August and taking another stock take at that point. Thank you.
Thanks, Stuart. And I mean, obviously in the report, it does say it's some of the problems with the garden. There's been contractors getting them on time, and probably everybody knows that we probably all have had our own experiences of trying to get people for work. I hope that can be resolved in a good way.
Yeah, we discussed that in detail at the committee, and there's a very kind of, if you like, understandable rationale why the work has gone slow. And there's work in hand to keep the trustees on side. But it's another example where you wish it had not happened in that way, although it's kind of, if you like, there are justifiable reasons. Yeah.
Thank you. Any questions? No. Okay, that's noted as well. Council of Government meeting public minutes from the 19th of January. They're all there. Any questions to that? No, just to remind everyone, the next Council of Governor meetings, I think it's 27th of July, it is in person. So could colleagues on the board please confirm with Katie and Jenny whether they are attending or not. I hope as many people as possible will. It's a really good opportunity for everyone to meet face to face, and we will be expecting everyone to take a lateral flow test for that event. Okay, no questions, that's noted. June Board Strategic Development Agenda, you've got this in front of you to note. Obviously, earlier on in the board meeting, we had a discussion with Lynn about the waiting list position, ASD, ADHD. That is on the agenda. Just to say, Michelle and Stella and I met, I think it was yesterday. Yeah, it was yesterday. We probably might want to give a little bit more time to that item 6 on the agenda, so we're having a look at that, but that's on there and important for us to discuss. So yeah, and I hope everyone as much as possible can make that event in person as well. Any questions on that item? No, thank you very much. I haven't received notice of any items to escalate. I haven't received any other urgent business. So in terms of the meeting, do people feel that the papers they've received today were facilitated? Their participation today, were they clear? I know there were a lot of papers. I think Francis, was it 500 or whatever in the pack he flagged up? And also, do people feel we've had a good discussion on the issues today? Any comments people would like to make? Is there anything someone would like to think should be improved for next time? Okay, all right. Well, we always continuous improvement on that front. Thank you very much, everybody, for your participation. That is the end of our formal public board meeting. I will see most of you in part 2. If we could stop streaming and then have a quick word about coming back for part 2.